Okay, thank you very much, and you're very much welcome to this SafeHabitus webinar on occupational stress in farming. And I have been asked to be the moderator for this webinar, and I'm Peter Lundqvist from the Swedish University of Agricultural Sciences in Sweden, and I'm involved in this SafeHabitus as a member of the scientific committee. And I want to just start this webinar by saying a few words about how it's going to be organized. So we start now and keep it on here. Let you know that it's being recorded, and the recording will be available on the SafeHabitus YouTube channel after this one. And you can keep your camera off and microphone muted during this webinar. Please do that, and submit your questions to speakers using the Q&A function. And your questions will be answered during the Q&A session at the very end. So there will be very little time in between. So I think it will be better if we keep it to the Q&A session at the end. And use the chat function for comments, interaction with other participants and organizers from ADL. So that's if we have anything more to say here. Have a next slide? No? Yeah, here's the program. And we have today 5 speakers. So we try to keep the schedule here with each one here have a 50 minutes to present the speech. And I would also like to say that the first speech by Dr. Diana Van Dorn is based on her own results, own research, and but the other 4 presentations is results of the work package 4 within SafeHabitus, and it's and it's the topic there is the current and future drivers of agriculture change, assessing the implications for agriculture, for working conditions and occupational stress amongst farmers and farm workers, and which has just been submitted to the European Commission. That's a message from this group of researchers. So we continue here. Going to, I guess, to the first presentation by Dr. Diana Van Dorn, which is a research officer at Jägers. Please.
Yes, thank you very much. Oh, Peter, I have to go start. Thank you very much, Peter. I present to you today the relationship between stress and well-being among male dairy farmers. And to give some context, in 2013, there was a mental health pillar added to the European Health Union by the European Commission. And this policy prioritizes the need for improved mental health and well-being for all. And in this, there is a focus on vulnerable subgroups, which includes rural population. And this strategy assumes a linear link between reduced stress and improved well-being. And we want to look how that works for male dairy farmers in Ireland. So there's a large international body of research on stress and the high risk for poor mental health and well-being among farmers. As well, in Ireland, there's research on this topic, and these results show that 1 in 4 Irish farmers face burnout. 57% of farmers experience stress, at least one stressor in the past 5 years. That was a yes/no question. And dairy farmers recorded the highest prevalence of stress. 74% said yes to this question in 2018. And in 2021, that had decreased to 55%. Weather, workload, and finances were quoted as the most stressors, the major stressors for farmers in all farm systems. And social support was a mediating factor against stressors. So looking at the methodology for this current study, the data we used was collected as part of the Farmers Have Heart Cardiovascular Health Program, which was a large-scale farmer health study. And the that included a baseline health check, which was repeated at week 52. And the baseline data for this study was collected in 2018, which was a significant year in relation to bad weather affecting farming conditions. This study matched baseline week 52 data from 199 dairy farmers, and we used frequency for the prevalence of stress and well-being and cross-tabulations to study the relationship. And to understand the full range of stress and well-being experiences and changes over time, we kept the variables extended and used adjusted standardized residuals to understand which specific variable, which specific cell contributed to any associations we found. And I only report the ASR of 2 and higher. And some limitations to mention: some of the farmers in this study participated in a health behavior change intervention, which might confound the findings at week 52. And the study focused on male dairy farmers, and the smaller sample size, 199, limits generalizing the findings to other farming populations. So the measurements. Stress was measured with a single item validated scale and was asked as part of the health check by the nurse. We explained what stress was, so we defined it. The farmers could answer it in a 5-point Likert scale, varying from 1 not at all stress to 5 very often stress. Well-being was measured with the short Warwick-Edinburgh mental well-being scale and self-administered by the farmers. And that were 7 questions measuring emotional well-being and psychosocial functioning. So we're going to the results. The stress frequency at baseline and week 52. At baseline, we saw that 57% of dairy farmers reported moderate stress to some extent, 31 low stress, not at all or only a little, and a small group, 12%, reported experiencing frequent stress, often or very often. At week 52, the number of farmers reporting moderate stress increased to 66%. The group who was reported experiencing no stress increased from 18 to 28%. Farmers reporting only a little stress decreased to 0 at week 52, and the high stress, often or very often, decreased to 6.5%. So then we looked a little bit closer into these changes over the 2 time points. And we noticed that a significant, more than expected farmers reported no stress at all at week 52. A significant number of farmers who reported only a little stress at baseline transitions to moderate stress at week 52. And those farmers reporting very often stress frequency continued feeling this high level of stress over the year. So these results show a nuanced picture. So some farmers maintained low stress and others experienced more frequent stress. And those with high stress had no change over the year. So looking at well-being, at baseline, 46% of the farmers scored high well-being, good or excellent well-being, and 31 scored low well-being, poor or below average. At week 52, we saw that the high well-being decreased from 46 to 38%, so that was the farmers scoring good or excellent well-being. There was a substantial shift to average well-being from 24 to 34%. Low well-being slightly decreased from 31% to 28%. However, those farmers in poor well-being group, they remained the similar scoring. Again, we looked closer at these changes, and we saw a significant number of farmers moved from good well-being to excellent well-being at week 52, suggesting that those who start with good well-being are likely to maintain or increase it. Farmers scoring poor well-being remained scoring poor well-being, so there was no shift. Farmers scoring average well-being at baseline moved more likely to good well-being, and then the below average group had mixed outcomes. So some of the farmers moved to average well-being and others remained in the below average well-being. And then there were significant negative associations of farmers moving from low to high well-being, so that was less likely. So while some farmers maintained or improved their well-being over the year, this was especially for those who already started with high well-being. Those farmers with lower well-being stayed similar. So looking at the relationship between well-being and stress at baseline, we saw that the not at all stress group, so farmers reporting very low stress, was significantly associated with excellent well-being. Moderate stress to some extent was significantly associated with below average well-being, and often stress was significantly associated with average well-being. So there's no linear line in these links between stress and well-being at baseline. And interestingly, those farmers having often or very often stress, that was not associated with poor well-being. So this suggests that the impact of stress on well-being is highly individual. While some farmers may experience significant negative effects from stress, others may be more resilient. So looking at the relationship between stress and well-being at week 52, we saw that not at all stress was still significantly associated with excellent well-being, but this association was less strong at week 52 compared to baseline. And moderate to some extent stress was still commonly reported at week 52, but did not have a significant relationship with any specific well-being experience. And at baseline, moderate stress was significantly associated with below average well-being, but this diminished at week 52. And then there was a negative association between moderate stress and excellent well-being, so indicating that farmers with moderate stress were less likely to report high levels of well-being. So the conclusions of this study, the findings showed that the impact of stress frequency on well-being is highly individual and nuanced. There was no significant association between high stress frequency, often or very often, and poor well-being among dairy farmers. Some farmers may experience significant negative effects from stress, and others might be more resilient. And the findings suggest that factors beyond stress contribute to farmers' well-being. For example, the positive aspects of farming in Ireland, close connection to nature, physical activity, and community ties. And this study challenges the assumption that farmers as an occupation group are highly stressed and experience poor well-being. And while stress is prevalent, it does not uniformly lead to poor well-being. Some farmers, despite experienced stress, even improve their well-being, indicated resilience and coping mechanisms. So what are the implications? Although stress was prevalent among this subgroup of dairy farmers, only a small proportion experience stress frequently or constantly and are at risk of poor mental health. And identifying and supporting these farmers is a priority for interventions. Recognizing that stress does not uniformly lead to poor well-being allow for more targeted support strategies rather than a one-size-fits-all, or we target all farmers the same. Leverage the positive aspects of farming in support interventions, and adopt a multi-actor approach such as SafeHabitus that addresses both stress and well-being as connected but distinct constructs to improve overall mental and physical health and resilience of farmers. And my final implication, all farmers experience some extent of stress. Many stressors among farmers tend to be structural in nature, such as financial pressure, payments, and these stressors require systemic solution and policy change. Thank you.
All right, thank you so much for a very interesting presentation here. And we are actually, you were really quick, so we have really time for a question here, but we haven't yet anyone in the Q&A here. But if I asked you here, what do you think of? What are the implications of these findings, and how do these challenge the way we traditionally approach stress and well-being interventions for farmers? I mean, do you see any other way we need to support farmers in the way, since when you're presenting results like this?
well, the findings illustrate that there is a non-linear relationship between stress and well-being, and there is assumed that if we look at stress, so there's a high focus on stress reduction among farming, that well-being will follow, and this study challenges that, and it indicates or suggests that farmers have other coping mechanisms. So I think we need to look beyond only stress reduction and looking at targeting the high risk farmers rather than farmers as an occupation group. So there's individual changes and coping mechanisms, and I think it's important to look at the specific needs of farmers and a holistic approach, like look at social support, work-life balance, access to resources, in our way how we approach farmer stress and well-being. So it's a more holistic approach where we have to look at, and it's very important that we look at those farmers, those small percentage of farmers with the persistent stress, the persistent poor well-being, to target and reach those. Because I am afraid when we have these policies where we're going out with stress interventions, that we reach those who are already in the good or stress or low stress and excellent well-being. Well, we need to have concerted actions to reach those smaller groups with high levels of stress and poor well-being, because there was no change in that group. But I do have to say that it was interesting that poor or high stress did not necessarily lead to poor well-being. So there's we need to have targeted approaches.
Okay, and here's we have time for one short thing too. Why did the study not include female dairy farmers? By Vanessa here.
Yes, that's a limitation of this study. This study was carried out as part of a men's health study in Ireland. In Ireland, we have a men's health policy, and farming in Ireland is predominantly a male occupation, and we looked at cardiovascular health. But I do agree we need to also look at how this impacts female farmers.
Thank you. And then we have a final comment here by Fiona Colgan. Comment: it's a very positive message to learn that stress does not always equal poor well-being. There is a lot of misconceptions around this terminology. Thanks from Diane. Thank you, Diane.
Thank you.
Okay, and then there is, if stress was measured with a 1-item scale, how was it defined for the participants?
Yes, I have it in my, I don't know if the slides are shared. It is a validated scale. There's a lot of studies about it, and we defined, so we explained during the nurse did that as part of the health check, and we explained what stress was. So I had it in my slide, but to diminish time, I didn't read it out. I can read it out if you want. It was the question: stress means a situation in which a person feels tense, restless, nervous, or anxious, or is unable to sleep at night because your mind is troubled all the time. Do you feel this kind of stress these days? So that was asked at during the health check, and then farmers had a 5-point scale to answer from not at all to very often.
Okay, thank you. I think we have to save the rest of the questions to the Q&A. So big thank you very much. Interesting. Okay, so we continue and go to the next presentation, and the headline for this one is the cultural stressors of health and safety in agriculture, and it's going to be presented by Dr. I'm sorry for the pronunciation of your name, you have to correct me, Dr. Dushka Kneshevich-Ochevar.
Yeah, perfect. Perfect.
Oh, okay. And you're a senior research associate at the Research Center of the Slovenian Academy of Sciences and Arts. So, welcome.
Thank you very much. Okay, so hello everybody. As an anthropologist, I have been engaged in ethnographic studies that examine the suffering of different generations and genders on family farms in uncertain historical context of radical social change, such as, for example, the proclamation of independent Slovenia in 1991 after the dissolution of socialist Yugoslavia and accession to the EU in 2004. Two most recent anthropological projects in which I was involved as PI and which were officially concluded a week ago carried quite telling titles. First, Changes in Agriculture Through the Farmer's Eyes and Bodies, and the second one, Managing Social Pressures and Personal Distress on Family Farms. Today, however, I would like to briefly inform you about the most important results of a team that identify the cultural stress factors in agriculture in our systematic literature review. Next slide, please. Since in our obtained articles repository, there was no systematic literature review on cultural stressors that shape health and safety in agriculture, we first drew on cultural anthropology as the foundational framework, acknowledging culture as a broad and complex concept that encompasses beliefs, practices, and symbols shared among farmers and farm workers. Key characteristics of culture include its depth, manifestation at different levels in terms of observable artifacts, values, or basic assumptions, its influence on behavior and biological processes, in our case, safety and health, social and psychological distribution as learned and not inherited phenomenon, capacity as descriptive and not a judgmental concept, and its capacity for gradual change. We also question the outdated anthropological views of culture that oversimplify it as homogeneous, static, or uniformly distributed among cultural group members, and instead emphasized that farming culture encompasses different agrarian values, different and various cultural identities, different health beliefs, different risk perceptions and discriminatory behaviors, all of which contribute to health and safety risks in agriculture. In line with the foci related to the above discussed culture, we reorganized the initial questions drafted previous year in workshops for the systematic literature review into the general one, which reads, how does farming culture shape the safety, health, and well-being of farmers and farm workers, focusing on farmers and farm workers' understanding of risks, hazards, and problematic relationships in their workplace and changes that affect the farming culture. Next slide. And here are some characteristics of 45 reviewed articles. In addition to the overall picture about geographical location, about the majority of articles stemmed from the US, let me noting that the majority of studies on the health, working, and living conditions of migrant or seasonal farm workers, as well as their relationships with employers and healthcare providers, are from the US, 76%, with smaller contribution from Canada, 12%, and Europe, 12%, but on farm workers, migrant farm workers. However, studies on the health and safety of farmers and their families are primarily from Europe, 40%, followed by Australia, New Zealand, 20%, Canada, 20%, and the US, 20%. Year of the study, studies on the health and safety of farm workers, including migrants and employees, were primarily conducted between the late 1990s and 2021, with the most recent study occurring from 2019 to 2021. Research on farmers and their families was more concentrated in the last 2 decades, with a few studies lacking specified dates. The studies encompass a broad range of target groups in the agricultural sector, including farm workers, farmers, healthcare providers, policy-level informants, extension workers, outreach workers. However, migrant and seasonal farm workers and farmers predominate. Healthcare providers and advisors were included in 3 studies, with 1 study exclusively focusing on healthcare providers. 4 studies involved all these diverse groups, from farm workers to policy informants, local communities, and various agricultural stakeholders. Qualitative methods predominated in the studies on the health and safety of farm workers and farmers, 12 and 13 respectively. Exclusively quantitative methods were used in 7 studies per these study groups, while mixed methods were only used in 6 studies on the health and safety of farm workers and their relationships with different groups of people. Next slide, please. So, based on anthropological conceptions of culture and subsequent screening steps of systematic literature review, we identified 4 groups of cultural stressors. Ensuing analysis confirms that farming culture strongly influences the safety, health, and well-being of farmers and farm workers in all 4 aspects analyzed. Yet these cultural stressors are interconnected and not confined to a single dimension. Those studies typically emphasize one aspect based on their specific purpose and methodology. So in turn, the first group, cultural constructs of masculinity and femininity in agriculture, when threatened, can become sources of health and safety risks. These constructs are often perceived as natural and unchangeable, traditional, leading individuals to internalize failures as personal rather than as consequences of broader social, economic, and cultural forces. This internalization intensifies their suffering, as their response is based on their perceived loss of social and cultural status within the agricultural community. Second group, structural violence, discrimination, and vulnerability reinforced by cultural perceptions of certain social groups as others or outsiders perpetuate racialized hierarchies and inequalities in the agricultural sector. These disadvantaged groups face hazardous working and living conditions, are excluded from community life, and lack access to health-promoting resources. Language barriers further exacerbate their vulnerability by limiting their ability to receive safety training and education, leading to health and safety risks. Their marginalized status forces them to endure unsafe working conditions and continue working even when ill, with their suffering often going unrecognized or untreated due to differing cultural interpretations of illness and danger. Next slide, please. Third group. Farmers experience significant distress when there is a disconnect between their moral economy, where they see their work as contributing to both personal and societal good, and the unexpected, uncontrollable challenges in their work environment. This misalignment can lead to deep dissatisfaction and, in severe cases, makes distress or even suicide a possibility. Farmers who struggle to adapt to new farming realities and feel unsupported by the government may perceive these challenges as ethical injustices, which can severely impact their self-esteem, well-being, and safety. And fourth group, differing cultural perceptions of risk, danger, and control in the agricultural environment can be a significant source of health and safety risks as well. When farmers, migrant farm workers, and other stakeholders, such as healthcare providers or extension workers, have conflicting views on these risks, or when risks are normalized and ignored, health and safety issues are intensified. Additionally, culturally influenced health beliefs can lead to distrust and avoidance of medical treatments or safety precautions, while economic pressures drive both farmers and workers to engage in risky behaviors and ignore health problems, further normalizing pain, illness, and unsafe practices, even among children. Next slide. So if we relate the above cultural stressors to the identified drivers of change, such as the neoliberal restructuring of agriculture combined with technological progress, demographic changes, and climate change, we can conclude that the well-being of farmers and farm workers is increasingly at risk, with persistent inequalities and structural vulnerabilities affecting their health and safety. Therefore, Kendall Tu's call is more than timely when he emphasizes that understanding the cultural sources of health and safety risks in agriculture is not a prerequisite for successful interventions, but the lack of such understanding certainly increases the likelihood of failure. Thank you.
Okay, thank you very much for bringing up an interesting area of research that's not so often being discussed and talked about. So thank you very much for that one. And we have a few minutes left until the next presenters. If anyone wants to put up a question, you're welcome to do it within the Q&A. And I might start to say a little bit here. Would you elaborate on the definition of farming culture and the cultural stressors for the purpose of this literature review? I mean, maybe you could say some more about it.
Yeah, as I said, we really drew on anthropological concepts, and every anthropologist has its own definition of culture. This is very difficult, but there are certain collections of contrasting definitions, and author on which we refer, Spencer Otis, she really collected and she identified key characteristics of all these definitions of culture, what is important, what is significant also for our systematic literature review. And the point is that, as Diana told in previous presentation, it is very important to have in mind that farmers have several cultural identities, that it is really reification if we say this is homogeneous group of people, this occupational group, because we have such huge differences by age, by gender, by ethnicity, by socioeconomic background, by type of farming, and so on, that it is very important to really rely on very broad conception of culture. And we follow her example and try to combine our analysis with these conceptions. And at the same time, she also stressed the obsolete notions. Why this is important? Because researchers from other academic backgrounds who are not anthropologists or social scientists usually employ, for anthropologists, obsolete concepts of culture, or probably they restrict their analysis to language or to customs or to certain elements of culture. But culture is a process, and we are not passive carriers of cultures. We also must have in mind that human agency must be included in culture. So we co-design or co-produce this culture. It's not only that we are carriers of cultures, all homogeneous, and so on and so on. So yes, people have different coping mechanisms, and we are not talking about all farmers or workers in agriculture as unique, uniform, static group, frozen in historical time framework. But that's why it's maybe even more difficult to grab this culture in interventions. Because I don't know how to design really effective intervention for cultural stressors.
Okay, thank you so much. And I think it's very important that you as anthropologists come into this area of research as well. We haven't had that so much into this area. And I also think it's very good that both you and the previous presenter talked about the farmers as individuals. You're going to just bring all farmers together and talk with them like a one concept fits all. They are individuals and so many different situations for individual farmers. So thank you so much for your presentation. Thank you very much. I'd like to add also that if you want to learn more about our speakers today, you can watch on the webpage about there is biographies, more information about each presenter we have today here. So if you want to learn more about them, if you haven't met them before, you don't know them before. So then we go to the next presentation, and it will be about stress among farmers and farm workers by Dr. Natasha Denocek-Hafner. Sorry for my presentation. Okay. You're a research associate at the Social Medical Institute Research Center of the Slovenian Academy of Sciences and Arts yourself as well as the previous one. So you're much welcome.
Thank you. Good afternoon. Best wishes to everyone and thank you for coming. It's great to be here with so many experts. Today I would like to focus on a variety of stress factors that different groups of farmers and farm workers are exposed to. Next slide, please. To begin with our core question in literature review, which was what causes farmers and farm workers stress today and what will cause them in the future. I will not bore you with PRISMA methodology. It is well described in our report, but among a huge amount of articles screened by abstract, there were over 600. We then focused on only 31 selected articles, which were at the end relevant for the final analysis. Next slide, please. The results of full text reviews are as follows. The data collection for the studies analyzed took place between 1984 and 2022, which indicates a long-term period of study years, as the first wave of the oldest study dates back to 1984. Most of the studies were published after 2050 and they took place in USA. And as you can see, most studies were quantitative. Among the target groups, farmers are predominant target group, followed by migrant workers, farming couples, and farm parents and young adolescents. Next slide, please. In our review, we have tried to identify the most important stress factors among farmers and farm workers and their impact on mental health. Key stressors include financial issue, health problems, climate change, occupational factors, changes on global market, and family dynamic. To begin with, financial struggle. Particularly high debt are the primary predictors of stress. Among young adult farmers and ranchers, personal finance and time pressures were also the sources of great concerns. Then the second one, environmental factors such as climate change, especially unpredictable weather and drought. This exacerbate stress through financial strain and increased workload. Another important causal factor is exposure to pesticides. Among occupational factors, the most important are workload, the level of autonomy, long working hours, performance pressure, labor workforce availability, and also aging workforce, worker interest, role definition. The study, which examined the effects of work demands and gender on occupational and psychosocial stress in farm worker couples with children during the agricultural season, and this is also important at times of low and high work demands, showed that women experienced more work-family conflicts and less support at work. Then health and safety risks. Injuries among farmers and farm workers are presented as most important health and safety risk factors. The study, which focused on self-employed farmers, and ranchers showed the high perceived stress level were a risk factor for injury. Stress, sleep deprivation, and fatigue showed a similar positive association with injury. Some studies identified livestock as the most common cause of injury. The next group of predictors with the highest value with health indicators were limited health care access and chronic illness, then a doctor visit that was not possible due to high cost, limitation or interruption of activities at the farm due to illness, problems with health insurance, and number of prescribed medication as well. Then market dynamic include global competition, consumer trends, and conversion to organic farming. If I explain this conversion to organic farming in more details, conversion to organic farming requires a period of 18 to 24 months, depending on the dairy farmer's choice, and represents a major challenge. During this conversion, farmers must comply with organic farming regulation and make a variety of changes in farming practice, marketing strategies, knowledge sharing networks, and social relations. Even if they do not yet receive the organic price for their milk. Last but not least, social and community issues like isolation and loneliness, family dynamic, meaning generation gap, housing condition. This was especially actual among migrant workers, and this is of great concern during this farming community. All these stressors presented can affect the health of farmers, both mentally and physically, as well as the health and resilience of farms. As we all know, farmers have a higher incidence of depression and suicide attempt than other occupational groups, and mental illness among farmers has increased in recent years. Farmers have also a significantly higher index than almost all other occupational groups with regard to worries about the future. A subgroup, migrant farm workers, face additional challenges, including poor living and housing conditions, social isolation, and fear of deportation, resulting in high levels of depression and anxiety. Then substance abuse, particularly opioids and alcohol, is prevalent and affects both health and productivity of migrant workers. Other concerns include the high risk of suicide among male farmers, as I already mentioned. Next slide, please. So, what are recommendations and future directions? Main focus is the topic of injury prevention and stress reduction in farmers and ranchers, and its potential impact on family functioning. The experience of injury may have led to depression, but also depression may have led to injury. So longitudinal studies are needed to clarify these causal pathways. Then the results suggested the more attention needs to be paid to stress in the workplace. Developing a safety culture to prioritize the well-being of farmers can be an important prevention strategy to reduce the risk of occupational accidents and stress. There is also a need for targeted community-based intervention to raise awareness of mental disorders and the development and implementation of culturally appropriate initiatives first to prevent, then to detect, and if needed, treat mental health problems among farmers. Some of the concrete measures proposed relate to specific climate situation, drought, health risk to farmers can be included in drought early warning plans and local strategies to mitigate the effects of drought and reduce the burden on farmers, reducing stress and financial threats and increasing social support for farmers, which is also very important protective or preventive factors. Next slide, please. Thank you for your attention. If you have any question, do not hesitate to ask. You can ask them in the chat.
Okay, thank you very much for an interesting review of the literature here and bringing up a lot of interesting issues here. I'd like to start with a question on my own. I've seen reviews and I've done it myself, and I've seen a lot of stuff coming up when it comes to bureaucracy, the stress for farmers about bureaucracy, administration, regulations, inspection by authorities, and so on. Have you found anything about that within your review?
Yes, this, how can I say, governmental or system measures are also important, but to solve them, it requires interdisciplinary efforts, and it's a long run to solve these issues or problems.
Okay, thank you. And there is a question in the Q&A here. We have a few minutes from Klaus Klugman. Stress increased in recent year more in AG. I don't know what that means or stands for, as in the rest of the population. And if so, can you give evidence? AG, I don't know what he talks about. Can you?
Well, among farmers, there are reviews about suicide attempts. It's greater than in other occupational groups. I believe that about stress, there are new research which have to be done to I don't know, to clarify these issues. But as far as I said, suicide and then how they see the future, there are not so good results or among farmers.
True. And I think I missed out a earlier comment by Jarkko Lepälä. Also, maybe it's been for an earlier presentation, but he commented there has been suicides also in large and economically welfare farmers, not just poor farms. That connects to the things you've been talking to here. And also there is from Mario here, he's asked, there's a question here also related to my questions I had before. Do you think the stressor can be related to this trust of institutions? That you don't trust the authorities or whatever? It's the stress that they have mistrust.
Yes, how to gain trust or how to gain safety environment. This is not easy solved question. I mean, you gain trust in a long run, and also a government or some agency must put some effort in this to step one step near the farmers to show that they understand at least them if they just don't can help with some, I don't know, legislation or so on.
Sure. And there is a final comment here by Joe Fernhaber. Comment, rural communities in the US, from experience and from your reviews, are sometimes xenophobic, but the population often relies on migrants for their work and benefits from them in many ways. How would we address this in Europe?
It's the same problem here in Europe, because we lack of workers, and we rely on migrants. They are not in such huge numbers as in USA, but we should search for some common solutions in next years. It's something which is already happening now. I don't have an answer to this question.
Okay. Thank you very much for your excellent presentation, bringing up very important new knowledge for us. Thank you very much. Okay, so we continue in this number of presentations here. We have still a few interesting stuff here. We have a next presentation here. We'll have the headline of Challenges of Social Protection of Farmers and Farm Workers. It's Dr. Sanja Kukuc, research, sorry for my pronunciation again here, research associate also at the Research Center of the Slovenian Academy of Sciences and Arts. Well, much welcome.
Thank you very much for this introduction. Hello to everybody. Thank you for coming. As has been said, my presentation will be sort of a continuation of the previous two on the challenges of social protections of farmers and farm workers. So if you could just switch to the next slide, please. So in line with the aims and the goals of our literature review, the two main research questions that were posed were what is the level of social protection among both farmers and farm workers, both compared to other occupational groups, and also the aim was to identify the particularly vulnerable groups in agriculture in terms of access to social protection measures. And the second related research question was what are the main barriers to accessing social protection for farmers and agricultural workers. In line with the procedure that has already been described by Natasha in the previous presentation, we have found among the 600 articles, more than 631 articles that were relevant for the final analysis, and we have identified four, let's say, cross-cutting topics. The first topic was access and formal social protection. The second topic relates to means of informal social protection. The third topic is discrimination and structural barriers. And the fourth topic is cultural and language barriers. So the next slide, please. Okay, these are the most important characteristics of articles that we have analyzed. As you can see, most of them, over half, come from either USA or Canada. We have 3 studies from Turkey. Then we have 2 studies from Australia, Spain, Finland, and 1 study from Netherlands, Norway, Poland, Ireland, Germany, and Sweden. And in our review, we have had only 1 cross-national study, which was basically a comparison of 2 social security systems. All of the articles, besides 2 of them, were collected between 2000 and 2023. So it is sort of a topic that has been mostly brought up within the last 2 decades. And we have 16 quantitative, 10 qualitative, and 5 studies using mixed methods. In terms of the target groups, you will see them here. I will mention that some of the studies, so that's why the numbers may not add up. Some of the studies addressed more groups, for example, migrant farm workers and service providers, or farmers and service provider stakeholders. But Most of the studies were almost half of them addressed solely migrant farm workers. Then we had service providers, stakeholders. There were some studies that compared farmers to other occupational groups. A couple of studies on farm families where, for example, spouses were interviewed. And then we had more particular groups like farmers with disabilities, farmers with injuries. One article focused only on female workers, and one article only included male farmers. And some articles were, let's say, more general, farmers as their main target group. Next slide, please. Okay, what were the main findings of our literature review? One of the main, let's say, measures of social protection, or you could also call it health social protection, is the health services uptake of farmers and farm workers. And we have found that this health services uptake is lower, generally lower compared to other occupational groups. And of course that this uptake, as has been mentioned also before, is even lower for migrant farm workers. That means that farmers or farm workers do not have health insurance or are not using their benefits, or they're not using health and social services for various reasons. Some of the reasons we have identified are listed here. So health insurance coverage or the lack of health insurance coverage. Then we have, for example, also the issues that pertain to lack of access. Access is a very, very strong topic in the analyzed articles. We have the issue of language, the issue of translation or the lack of translation. We have the issue of the lack of information, for example, on how to access workplace insurance. For example, transport is also an issue, culture of long working hours, financial reasons. For example, there are hidden costs a lot of times to go to urban areas. There is a reluctance of employers to report injuries, for example, to compensation agencies. Employers often evade safety and health regulations. For example, prevent farmers or farm workers from using paid sick leave. Presenteeism is often present. That means that you are present at your workplace despite some illnesses or injuries. Then there is a lack of preventing farm workers to access self-insurance cards. There is also, of course, a lack of understanding of the farm profession among professionals, among stakeholders, and there is often also a distrust in professionals that come in contact with them. In terms of the informal social protection, we have found that the family is, in most of the studies, listed as the main provider of informal social protection. So especially in cases of disability injuries, there is heavy reliance on the family and the family networks. But there is also, in some studies, have found that there is also reliance on employers, for example, for farm workers in assisting translations, accompanying people to clinics, mediating conflicts, organizing services, and so on. Of course, we have also found gendered responsibilities of care and household labor. So there are inequalities in the distribution of this labor. And there is, of course, particularly, for example, for single mothers, there is a lack of these social networks that could meet all of these household needs. And also, as important, church and community leaders have been identified in some of the studies. So the next slide, please. So the other two topics relate to two issues that have also already been mentioned. The issue of discrimination. So particularly for migrant farm workers, there is the issue of racism, xenophobia, structural vulnerability of these workers, their position, their lower position in work hierarchies, often doing physically demanding work, which leads, of course, then to health disparities, to inequalities in health. Distrust in authorities, this is also an issue that has already been mentioned, and the naturalization and internalization of distress, which means that distress is often, let's say, attributed to certain cultural characteristics. And of course, there are related to this also communication and translation issues, and in this respect, culturally appropriate care, and also the importance of farming culture, which is one of the topics that has also been discussed previously. So what are the reasons that farmers or farm workers do not want to seek help? What are the obstacles in farming culture? This, let's say, culture of privacy and independence are among the main reasons. And to the outlook, because this, let's say, delivery was also dedicated to thinking about the future of farming, the studies do emphasize that there will be also further reliance of on migrant workers, on migrant farm workers in agriculture, which is something that we can expect in the USA and also here in Europe. COVID-19, of course, has heightened particular vulnerabilities of this, let's say, essential group of essential workers, which is also the focus of some articles. And with the disintegration of the welfare system in, let's say, most of the countries, we can also expect that there will be further pressure on the family to provide social protection. And of course, legal and administrative provisions, let's say, the climate in Europe and globally is very much, let's say, anti-migrant, xenophobic, and these legal and administrative provisions, recruitment policies, and so on, are expected to also get much more stringent. And of course, to sum up, intersectional factors and vulnerabilities, we cannot simply say that migrants, that farmers or farm workers are one homogeneous group, as has already been mentioned. So it's really important to take different layers of these, let's say, inequalities, vulnerabilities into account when we're talking about discussing social protection. There is really no one-size-fits-all recipe. So these are our main findings. And I thank you for your attention, and we'll appreciate questions, comments, any feedback from your part. Thank you.
Okay, thank you so much. There is a few minutes left. If anyone have a quick question or comment, but while waiting for that, have you any idea how can you organize better access to social protection systems? For how can it be improved for groups identified as particularly vulnerable in this review? Have you any idea about that?
Yes, I mean, quite a few of the articles actually discuss this, not in their results, but then in the discussion or the, let's say, conclusion section. One of the ideas was, for example, to get the care where it's most needed, right? For example, you organize a mobile clinic that will go where the people are. This is to put it simple, because there are all these obstacles like, I don't know, lack of transport, rural, remote areas, and so on. This is one. Then one of them, of course, is to also make professionals aware that this is an important issue, right? In terms of this culturally, let's say, appropriate care, which does not refer only to migrants, of course, it also refers to the specific of the, let's say, farming culture that farmers are supposed to be strong, independent, and so on, right? Also to make the professionals a bit more aware of this, and also the reasons why some people, why farmers or farm workers may not seek help. And also another strength, which has been emphasized by Natasha also, is this, let's say, multi-community, multi-stakeholder, or whatever you want to call it, right? Networking, working together to address this issue to, let's say, improve access. Of course, there are more, let's say, structural issues, which I will not go too much into. There is a structural organization of, I don't know, migration policies, right, which we are all aware of. But these are then, this is the, let's say, macro level, of course, which we always have to have in mind, but it is, of course, very difficult to address in terms of improving access. Yes.
Okay. Yeah. Sounds reasonable.
Yeah. Unfortunately.
Yeah.
This is, yeah.
So thank you so much for also another interesting presentation. Thank you very much.
Thank you.
And so we go to the final presentation here in this very interesting webinar. And it's the title is The Anticipated Benefits and Drawbacks of the Digitalization of Agriculture for the Safety and Health of Farmers and Farm Workers. And also another important issue, and it's Dr. Maja Černik-Šteniks, Senior Research Associate at the Research Center of the Slovenian Academy of Sciences and Arts. So we're looking forward to hear your results from your studies. Welcome.
Yeah, thank you very much, Peter, for your nice introduction. And I would like to greeting all the participants of today's webinar. Very happy to have you here and to present also my results together with also very interesting results of my colleagues. So yes, first of all, I would like to say some background of our interest to look to the topic of digitalization in agriculture. So yeah, digitalization, which has successfully found its way into many areas of economy, is expected to have a significant impact on agriculture and the people who work in this sector in the coming decades. It is anticipated that this technology will enhance productivity, strengthen environmental protection, and improve the working conditions of farmers and farm workers. Funding, research, and the application of scientific knowledge to promote digital farming, or to name it with other terms as well, such as smart farming, agriculture 4.0, precision farming, and etc., are increasing. Technology researchers and experts, manufacturers, and commercial companies are making great efforts to develop and introduce the new products and devices and provide solutions as quickly as possible and to equip farmers with them. Recently, however, there has also been a focus on analyzing the barriers that prevent farmers from adopting and using this new technology, as only a relatively small proportion of farmers, for example, in Europe, about 10 or at least 20% use such modern equipment so far. The extent literature reviews on the technical aspects of digitalization in agriculture shows that many of these modern technological products and devices are still technically incomplete and under development. Great share of them only exist as prototypes and require to be further refined, improved, and tested, particularly in terms of safety. The farming environment places particularly demands on the implementation and usage of digital solutions. So this is really particular area where digitalization finds various challenges. In addition, the use of modern technological devices is hindered by a number of other factors, such as the cost of hardware, problems with the integrity and security of data management, the unavailability of infrastructure, such as internet access, mobile networks, including Wi-Fi and base stations, incompatibility between different devices due to inconsistent digital standards. The adoption of modern technology in farming is therefore not quick, straightforward, and uncomplicated process, which is also reflected in the number of selected articles in our analysis. In our part of the literature review, we were particularly interested in the impact of this new technology on the working environment in farming, and we asked ourselves the following question, which led us to the analysis of selected articles. So this question was, what is the impact of the use of new technologies in agriculture and working environment, safety, health, and well-being of farmers and farm workers? So because of these limitations already presented, the number of articles which we select is also relatively low in comparison with the number of articles which were analyzed in the previous topic. So this area of research and also the implementation is pretty new, and this is also reflected in the number of articles selected. The articles selected were published between 2004 and 2023. Most of the data used in these articles were collected between 2012 2022, which really show that this is the new field of research. Countries where these studies were conducted are different, are varied. So we selected, or we got with our screening of abstract and titles, 3 articles from Norway, 2 articles from Canada, 1 from Finland, 1 from Australia, 1 from New Zealand, 1 from Malaysia, and 2 articles where data were collected from several countries in Europe. The methods with which the data were collected were various as well. So half of studies were using quantitative approach, methodological approach, while half of articles collected their data with a qualitative approach, and just 1 used the mixed method. With the difference to other topics, in our in our group of articles, only farmers were the target groups. Into also farm managers and share makers, but mostly farmers were those who were addressed in these studies so far. Well, the results show that the result of our corpus of selected articles show that automatic milking system is by far the most frequent represented and discussed technology in the literature. This robot, or more precisely a robot arm, takes over all milking production tasks so that milking can be scheduled on a 24-hour basis, and the animals themselves decide when they want to be milked. In fact, this robotic device is already considered a classic application of modern agricultural technology. Since the late 1990s, this system has been used mainly in Western and Northern Europe to reduce the amount of labor on dairy farms, increase production per cow, and improve the lifestyle of dairy farm families. In recent years, agricultural robotics has experienced unprecedented development. In many automatic milking system models are now technically ready for use and available on the market. However, this is less the case with robots for plant and fruit production. So this is the reason that most of our articles addressed this type of modern technology. The main reason or motivation for adopting new technologies is to increase the economic efficiency of farms. That is to increase productivity, reduce operating costs, and reduce labor costs. So to make farmers more competitive. An important motivation for the adoption of new technologies, which was seen from the articles, is that the improvement of working conditions on farm is also important, as well as that the reduction of repetitive routine tasks and farming, and the possibility of working more flexibly and having more free time. The positive side of the new technologies is reflected as research in selected articles show in improved working conditions, job satisfaction, work-related physical and mental health, quality of life, and well-being. At the same time, however, the results of our analysis also show the negative aspects of the use of modern technology. For example, our analysis showed that increased flexibility of work can increase by permanence of the work process. For example, the constant need to be available around the clock to manage technology, which can lead to stress. Night alarms are particularly an issue in this context. Then, additionally, the maintenance of technology and repair of broken parts can cause significant stress, particularly for farmers lacking sufficient technological knowledge and expertise. Furthermore, the overall burdens of information and data related to the new technology can also lead to techno-stress among farmers. Also, new technologies allow farmers to expand and become more productive. As a result, farmers have reported that their workload has not decreased. The workload has also increased because farmers have to manage more animals, crops, to justify the investment in new technologies or data points, which can overtax their physical and mental abilities. Furthermore, familiarize animals with new technologies such as automatic milking system requires time and patience and also brings stress to farmers. And also farmers may have no sufficient training or skills with new technologies, leading to feeling of inadequacy and anxiety. And last but not least, investments in new technology often require considerable financial outlay, which can lead to increased debt, and this have a pressure on farmers to repay loans and less justify the investment with improved productivity, which all can also lead to financial stress. However, the articles which we analyzed in this group of selected articles also bring some positive sides anyway. So the results of the literature review have also highlighted the necessity and the new ways of this negative and how to weigh out of these negative effects. First of all, to secure an effective training and support for farmers, that is the availability of counseling and advisory services is needed, which seems to be crucial for smooth transition to new technologies and the reduction of techno-stress. As well, it is also very important to strengthen social networks and social capital among farmers. The articles we analyzed showed that those farmers connected with other farmers experience the introduction of the new technology easier and less stressful. As the limited empirical evidence on the experiences of farmers and other relevant actors, like example, advisor extension service with new technology, Further research is needed to investigate other barriers, burdens that could cause stress to farmers, for example, lack of comprehensive protection of big data, lack of clarity on ownership of data, lack of availability of infrastructure, and etc. This needs for research has already been emphasized in the research on the social dimension of new technology, and their suggestion is worth to follow, especially because, as we already learned from the previous presentations, the number of stressors which farmers are exposed are big, are enormous, and these additional technical or stressors coming out from the introduction of new technology can even make this list bigger, and this coexistence of different stressors, this can really be a great issue to farmers, and last but not least, also to the attractiveness of farming. So thank you very much for your attention.
Okay, thank you very much, Magda, for an interesting presentation, and it's an important area of research that you're bringing forward to us, because I mean we are depending on the introduction of new technologies, and you're talking about both the positive things and what could be the stressors, and I understand that farmers have mixed feelings about using new technologies and adapting to them, because the stress factors, it's a lot of investments and risky situations in different ways. So it's very interesting to see that. So thank you so much. And we have about 10 minutes left for Q&A. And I'll see on Q&A there is discussions going on. But I find it a little bit hard to just put it into, it's like discussions and comments there in between people here in the Q&A. So I would ask you to come forward with direct questions or presenters here. So if that would make it easier for us to use this time, if you can write short questions to presenters. That I would think that will make it more easy for us to use this final time than trying to relate to the discussion going on in the Q&A.
I see there are some questions in the question and answer.
You can see?
Yeah.
Okay, please, if you see one, if you would like to answer one of the questions there, please quote.
Yeah, just, but farm environment, social, I'm not, I wonder if this increasing use of technology is outlining, could interrupt some of the protective aspects of connection to nature.
Yeah, that would be for you, yeah, perfect.
Yeah, well, yeah, the farming context is very demanding, as I already said in my presentation. So this digitalization was very successfully implemented in many economic sectors, while agriculture is particular. It's demanding because there is interactions of many actors, let's say humans as well as animals, as well as plants. So, and what I find out from the previous literature reviews is that it's not so easy to create the algorithms to harmonize the cognitive reactions of humans and the animals, or even the robots. So this was, as I understood, more the wish to harmonize all these actors together. But so far, the technology didn't find a solution yet to this way. So there are some solutions already, as this automatic milking system, which is not so complicated, but in other areas, the scientific efforts, as well as those who are taking care of the safety standards to implement all this equipment have still a lot of work to do. So these expectations that the technology, modern technology will be here soon and very quickly is a little bit too ideal. So we will need to take some time, and maybe we can actually try to make working conditions in agriculture also with other measures, not to count so much on technology. So we have other measures to do also, other policy solutions to create before the technology will have the answers.
Okay, thank you.
Yeah.
So please, thank you so much, Mirja. And if there is any one of the presenters who wants to comment or give oral feedback to any one of the, if you find there is anything in the Q&A that you want to bring up or comment, I see that there are discussions about different things there, but I think it's a...
I see
yeah.
I see that there is a question about the elderly farmers. So our analysis showed that this technology can be very supportive to older farmers as well, and not only older farmers, but also disabled farmers who have some health difficulties. This technology, modern technology, can be helpful. So yeah, that this group of farmers should not be discriminated from using this, but more in-depth empirical studies are needed in this field to answer these questions. Yeah.
Yeah. Sure. I'm sure that it's not like all older farmers have the same problems. Otherwise, I mean, but of course, if we're sending out a digital questionnaire nowadays, as a researcher, we sometimes get feedback from farmers say they are not using modern technology and so on. So they want us to send them a questionnaire in written by having in an ordinary mail. They cannot answer things using internet and having things like that. So of course there are people having abilities to use different type of technology, and it has to be with age. Sometimes they haven't been able to learn about it, got new feedback to learn about it, and so on. Yeah. Do we have something else that I have forgotten or haven't seen here in, or any one of the presenters who wants to give comments or to what we have heard here today? So please come forward. If any one of you are 5 presenters here today, so if you want to add something more comments, please. Maybe Natasha, you would like to say something?
I've answered all my question in QA section.
Okay.
I write, yes.
Okay, there is nothing you will want to bring up here now?
No. Okay,
fine. Okay, we are almost at the end here. We are supposed to be ending at 4:30, and I'm really grateful for presenters here today. You have brought up very good subjects here, and you kept your presentations to the schedule. So I guess if other people have tight schedules, we have, everyone is happy about that, and we have kept in time there. So thank you so much for this. And here in the end, I also would like to see if we can have up, there is a reminder. Yes, I want to take the chance here to remind about that today we've had a great webinar, but there are new upcoming webinars very soon. We have the September the 9th. There is this webinar on understanding the number of injuries in EU agriculture. And September 11th, we have on keeping children safe on farms. So I guess if you go in and on the webpage for SafeHabitus, if you haven't registered yet, you can do it. So please do that as you see here. So, and thanks to everyone that have been presenting today, and thank you all, everyone, for putting up questions or listening to this webinar today. And thank you for Anna Maria Tomic from Edel that have been supporting us technically very well. And thanks for me, and I'll hand over now to Mr. SafeHabitus, Dr. David Meredith. Thank you.
David, we can't hear you.
Apologies. What I wanted to do was to express my appreciation to all of our presenters. Thank you for taking the time and effort to prepare for today and for the research that you presented. And thank you to Peter for chairing today's session. And thank you to Anna Maria in the background for running all the technological side to the webinar. And particularly thank you to all of you who have attended today and participated through your comments and questions. The final point that I would make is that whilst we're undertaking research in this area, we're not the only people who are actively engaged in this particular topic and issue. And I'll draw your attention to a number of initiatives that have been completed recently. The first of them is the EU CAP Network thematic group on mental health and agriculture, and they have a report that was published recently, and you can find it on the EU CAP Network website, and it's worth having a read. There are several recommendations in there that would be useful in terms of supporting the future mental health of farmers and farm workers across Europe. The second initiative that I would point to is one of the partners on the EU project, SEJA, the Young Farmers Association for Europe, is leading a project called FarmRes, and they are having their end of project conference on the 24th of September, and information is out there at the moment where you can register to attend that. And finally, and I think this is just a parting comment for myself, the issues that we've been dealing with here are very sensitive, and we need to deal with them very sensitively. We're frequently talking about issues of mental health and well-being, and we also heard reference here to the rate of suicide amongst farmers and farm populations. And when we're dealing with these issues, we've got to remember that the challenges that farmers face are multifaceted. They are occupational in nature, and their working conditions can increase stress and stressors, and that can negatively impact on their health. They face the normal personal challenges that everyone faces out there every day. And one of the really important things that we need to have in mind as we work in this space is that farming in and of itself is not a bad occupation for your mental health. Okay, there are many positive factors from farming and working in farming that support and protect mental health. So this is where we need greater research to understand what the challenges are that arise with the occupation and how we can best support them going forward. And that's what we're trying to do with this within the SafeHabitus project. So on that point, I'll conclude and thank everyone again for presenting, for sharing, for the technical assistance in the background, and of course all our participants. And we hope to see you soon at the next SafeHabitus webinar. Thank you. And
Thank you.
Good evening.